It's obviously very unfortunate. We know we've got the best policies and the best way of running the country, and we would love to stand candidates everywhere. But unfortunately, we do have a broken voting system in this country that means that we have to be sensible and grown up about working together to achieve the best for the country. And at this election, the idea of having a Tory majority dealing with things like Brexit and with NHS, with care services on the brink of collapse, is simply unthinkable. So we've taken the grown-up decision in a number of areas to work together with other parties to give us the best chance of overturning the Conservative government. In Norfolk particularly, where UKIP have stood down in favour of the Tories. We're by no means saying that we agree with the Liberal Democrats on everything, but we think that we have to unite behind certain candidates as the best way of keeping the Tories out. So all I'd say to all the Green supporters there is, we're very sorry that we weren't able to represent you. We are not able to fight that seat, but you need to make the decisions that are best for the country at this time.
Interestingly, perhaps UKIP have actually slightly changed their position. They now say, and have now told us on Carers World Radio Plus, that if Brexit is the key issue, then you should vote Tory. But if it's not, then you should vote for the Liberal Democrats.
Well, they're actually making almost a sensible point there, because this election isn't entirely about Brexit. I work for the NHS and I've worked in social care, and I can say that this election could be decisive for the NHS. I don't think the NHS and our care system will survive in its current form for another 5 years, surviving underfunding and through privatisation as well. So UKIP are quite right to point that out, and people should be weighing that on their minds when they're thinking about who they're voting for at this election.
Using your background in health and social care, what do you feel are the problems that need sorting out?
There are a number of huge problems. The first that needs to be sorted out is the issue of privatisation. Health and social care services are best run publicly. They're best run in the interests of patients, not in the interests of private shareholders or investors. And we need to make sure that ownership of all these services publicly remains, and all the privatisation that's taken part so far is rolled back. And the Liberal Democrat proposals of putting in another £6 billion a year are worthless unless that money gets to where it's needed, and we can't guarantee that as long as we've got a fragmented and privatised system. So we would start by reversing the privatisation of the NHS by implementing an NHS reinstatement bill that would make sure it's fully public. Then there is the significant issue of underfunding. NHS services across the country have been underfunded. In Cambridgeshire and Peterborough, we're looking at £500 million annually being taken out of the health economy here by 2021, which is completely ridiculous, because it can't happen without costing lives and without costing people the care and the dignity that they need. We also need to make sure that we support carers and those working within the system properly, and I'm talking about paid carers and also unpaid carers. Those who are working in carers positions, such as myself was a few years ago, they need more reward, because simply the wages aren't good enough and the training also isn't good enough. And we also need to recognise that unpaid carers make a huge contribution to our system and save the country billions of pounds by helping care for their relatives and their loved ones. And they need to be rewarded and looked after properly as well, because there's an unbearable strain on many of them at the moment.
Some of our audience are telling us that, in fact, what we should be seeing, rather than the many people applauding their efforts as unpaid carers, to actually say, let's pay carers, let's support them properly, let's train them properly. And their argument is that not only could they deliver really good care for the person they care for, but also save the state money. What would your view on that be?
I'd say absolutely. It's very frustrating that care isn't recognised in that way, and that people aren't given the support they need to be able to look after their relatives. One of our flagship policies, something that no other party is talking about, is the idea of a universal basic income, which in the future could possibly be a way of rewarding those who have to do work which at the moment isn't recognised and isn't paid, to make sure that everyone has a basic salary to meet their needs, to get by on. And it means you could take time out of work and afford to do so to look after your relatives, because simply at the moment a lot of people can't afford to do it, and they're being placed on, under huge amounts of strain.
Labour are proposing in their manifesto working towards a national care service. UKIP speak about health and social care being pooled together effectively into a new government department. Do you believe that either of those proposals would help?
Essentially, the care system in recent decades has been privatised, so whereas councils and local authorities used to publicly provide care for people, that's increasingly moved into the private sector. And I don't think it's worked. The system isn't effective. A huge amount of care homes are closing because we're not funding them properly. I don't think I agree with either Labour or the UKIP's proposals, and certainly the Tory proposals of making it a lottery in terms of, if you are unlucky enough to have dementia or Alzheimer's at the age of 60 or 65, you could lose everything to pay for that, and your family could lose the house that you grew up in, I think is a disgrace. What we should be saying is that we need a universal system whereby everyone who needs it can get access to good, dignified treatment, which can be funded through progressive general taxation, and those services should be funded publicly. In Scotland we have free personal care for the elderly. There's no reason it can't be done in England and Wales as well, but it does need to be funded properly. But there's a huge amount of untaxed wealth and and other areas of taxation we could look at, such as property and financial transactions as well, that could be used to bring in the money to provide that universal system, and there's no reason why we can't do that.
So you would be in favour of spreading the risk amongst people, as other parties are, apart from the Conservatives who say if you can afford it, you pay for it?
Certainly. I mean, things like I've already said, such as dementia or Alzheimer's, are a lottery. It's and the whole idea underpinning our National Health Service was that you wouldn't have to face those illnesses and those diseases yourself. That we would share the risk, we pay in together, and we make sure that whoever gets hit by a disease or an illness like that gets the support that they need. And that's also the most effective and cost-efficient way of doing it as well. Because paying for it privately will cost a lot more, it would be more ineffective, huge amounts of money will disappear out to shareholders and private investors. If we have a national care service, bring these things in publicly, fund it through progressive general taxation, that's the most effective and definitely the most fair and caring way of providing that system.
And in terms of the welfare system, the principle that the Conservatives so far in government have adopted is that people should be assessed, and on the basis of that assessment they should be paid what is appropriate. How far do you go along with that?
I think the regime of forcing people to go to private assessors, private companies, to be assessed for employment support allowance, to be assessed for disability allowances, is definitely the wrong way to go about it. We should be trusting healthcare professionals, GPs and nurses who know their patients and will make decisions in the patient's interest, rather than private companies who are almost duty bound to try and get as many people onto lower levels of benefits or off benefits entirely. Where we in the Green Party would trust healthcare professionals to make those decisions, we would definitely make sure that there was an uproot in the rates of benefits being paid to people so they keep pace with inflation. Because what we've seen recently is benefits and welfare being paid to people not keeping up with inflation, forcing more into poverty, and especially those with disabilities, making it more difficult for them to live independent lives. And it's very important that we rectify that situation.
If on June the 8th you're elected to be the MP for your constituency, and on your first surgery a carer came to you in difficulties saying, I've been an unpaid carer for a long time, I've got to go back to work, I'm being criticised for going back to work, I personally have feelings I've fallen out of love with the person I'm caring for, a whole mixture of emotions, and on Monday I've got to say whether or not I accept a job offer or not. What advice would you give this person?
It's obviously a very difficult situation. I'd like to offer them as much help and support as I possibly can. I would love to signpost them to areas that would help them, but simply at the moment there isn't enough support for people, for carers. I have personal family experience of living with someone with a disability. I've seen many families struggling to get by in the care system through my work as well, and I know that the support's not good enough. It's just not there at the moment. So I would offer them as much support as I can. I would say, obviously, you're doing a brilliant job in caring for your loved one, and that's something that we should all respect. But ultimately, we need to make sure there's more in place for those people, and that's what I'll be fighting for if I'm elected.
And in terms of those in our audience who are caring for people with disabilities, what's your message to them?
Well, I think the government's record on helping people with disabilities has been appalling over the last 7 years, from the bedroom tax to the changes to disability living allowance to the closure of the Independent Living Fund. There's been a huge push by the government which has actually made it far less likely for people with disabilities to be able to live those independent lives and get the support they need, because it's simply unfair. As a person with a disability, you've got a whole load of added costs in your life, from the cost of adaptations to your home to the extra cost of transport, which the government is simply not helping people meet at the moment. And these people with disabilities can make a huge contribution to our country and to our society if they are able to get out and do the things and contribute, but they need support to do that. And I find it appalling that our government, for example, has been investigated by the United Nations on its abuse of people with disabilities, and they've said it's a systemic violation of disabled people's rights, and that's appalling. We should be leading the way on this, not falling behind other countries. So, as a Green Party representative, I would restore the Independent Living Fund, fight for the proper support for people with disabilities, and end punitive things such as the bedroom tax, which has overly penalised people with disabilities and made it far more difficult for them to lead independent lives.